Welcome to the deep dive. Today we're tackling something maybe a bit unexpected. Fungal urinary tract infections in dogs and cats.
Yeah, it's definitely not the first thing that springs to mind.
Right. We've got some, well, pretty detailed medical info here that sheds light on it. It's less common than bacterial UTIs, but definitely worth exploring.
Absolutely. Because usually you hear UTI, you think bacteria. Simple as that.
Exactly.
So the idea that fungi, which, can be perfectly normal residents on the body or just around in the environment, can cause an actual infection there, well, it's quite intriguing.
And the main one is Candida albicans, right? I think people might have heard of that one.
That's the most common one, yes.
Yeah.
Candida albicans. But there are other Candida species, too, less often seen, and even some non-Candida fungi that pop up occasionally.
Okay, so let's unpack that a bit. These fungi are just hanging around normally.
Yeah.
How do they suddenly become a problem in the urinary tract? What flips that switch?
Well, essentially, they're opportunists. The information points to Candida albicans being number one, like we said. Other Candidas are less frequent, non-Candidas even less so.
Okay.
And something that makes Candida quite good at this, apparently, is its knack for forming biofilms. These sticky layers.
Huh? Yeah, like on catheters.
Precisely, even on catheters, which makes them really tough to get rid of. It's also important to differentiate sometimes if an animal has a bigger systemic fungal infection elsewhere.
You mean like throughout the body?
Yeah, exactly. Something like Aspergillus in dogs or Cryptococcus neoformans in cats. The kidneys are filtering the blood, so the fungus can end up being shed in the urine that way.
I see.
But for today, we're really focusing on the primary infections,
Right.
the ones that start right there in the lower urinary tract, so the bladder and the urethra.
Gotcha. That's a key distinction. So it's not automatically a sign of a huge body-wide fungal problem.
Mm-hmm.
Okay, so thinking about who gets these, are certain dogs or cats more likely? Like specific breeds or ages, males versus females?
That's one of the interesting things, actually. The data we looked at suggests, well, there isn't really a clear link. No strong predisposition based on breed, age, or sex for either dogs or cats.
Huh. Really?
Yeah. And the symptoms, the typical signs you expect with a UTI, difficulty urinating, what we call dysuria, or going really frequently polyuria, they might be there, but often they're not. And visible blood in the urine grows hematuria. That's actually pretty rare with these fungal ones.
Wow.
In fact, quite a few animals might not show any obvious signs at all, asymptomatic.
No kidding. A fungal UTI with no symptoms. That sounds tricky. Easy to miss, I'd imagine.
It absolutely could be.
So if the usual signs aren't always there, what are the underlying reasons? What makes an animal more vulnerable to getting one? What are the risk factors we should know about?
Right, good question. What puts them at risk? The sources highlight a few key things. Diabetes mellitus is one, trouble regulating blood sugar.
Okay, diabetes. That often comes up with infections.
It does. Then there's something called urinary tract stomata. Basically artificial openings.
Stomata, like surgical openings.
Exactly, or openings from medical devices. So things like a perineal urethrostomy, that's a surgery sometimes done for blocked cats, or cystotomy tubes, which drain the bladder directly, or even just indwelling urinary catheters left in place.
Ah, I see. So those could be like an entry point for the fungi, or just disrupt the normal environment down there.
Pretty much, yeah. They can compromise the natural defenses. Also, having pre-existing problems in the lower urinary tract can increase risk.
Like what kind of problems?
Things like, say, bladder cancer, specifically transitional cell carcinoma, or even just having chronic bacterial UTIs already, it weakens the system.
Makes sense. Anything else?
And the other big ones are medications, recent use, or especially long-term use of antibiotics.
Right, killing off the good bacteria.
Exactly, allowing fungi to overgrow. And also glucocorticoids. Yep, steroid medications. They can suppress the immune system, making it harder to fight off any kind of infection, including fungal ones.
Okay, that pattern makes sense. We see that with opportunistic infections generally. So, given that the symptoms can be vague or absent, how do vets actually figure out if it is a fungal UTI and not bacterial or something else? How do they pin it down?
Diagnostics become really crucial here. The absolute first step is figuring out, is this just in the lower urinary tract, a primary infection? Or is it secondary, fungi showing up in the urine because of a systemic infection that's reached the kidney?
Okay, that's priority number one.
And we also have to remember, although it's rare, a lower urinary tract fungal infection could potentially travel upwards and cause a kidney infection itself. That's pyelonephritis.
Right, and that would be more serious needing a different plan, I assume. What about the urine sample itself? How important is that?
Oh, it's absolutely central. But you have to be careful about contamination.
Contamination, how so?
Well, the information points out that if the animal has, say, a yeast overgrowth on its skin nearby, like on the belly or around the vulva in females, or on the prepuce in males.
Like a skin yeast infection.
Sort of, yeah, or just overgrowth on the mucous membranes. Those fungi could easily get into the urine sample when it's collected, especially if it's not collected carefully, like via cystocentesis, needle into the bladder.
Ah, so you might see fungi, but they're just contaminants from the outside.
Exactly, so that has to be ruled out. And routine blood tests, like a CBC or biochemistry panel, they're usually not much help in the early stages of just a lower urinary tract fungal infection. You would only expect to see changes if things have spread.
So blood work isn't the main thing here. What about looking at the urine under the microscope, urinalysis?
Urinalysis is definitely key. You might actually see yeast or fungal structures in the sediment, the stuff that settles out.
Okay.
But if there aren't many fungi there, the numbers are low, you might need to concentrate the sample first to even have a chance of spotting them. And here's the really crucial bit. The source is stress. You cannot tell which specific fungus it is just by looking at it under the microscope. They can look similar.
So seeing something isn't enough to know what it is.
Precisely. And interestingly, imaging like X-rays or ultrasound isn't typically part of the initial diagnosis for just a fungal UTI.
Okay, that makes sense. Seeing isn't identifying. Which leads me to think, what is the best way, the gold standard for diagnosis?
Spot on. It really comes down to urine culture. Growing the organism.
Culture, okay.
Candida species, since they're the most common, they usually grow pretty well on the standard culture plates labs use for bacteria, the blood agar plates, typically within about 3 days.
That seems straightforward enough.
It often is for Candida, but, and this is important, other types of fungi might grow much more slowly, or they might need special conditions.
So they could be missed on a standard culture.
They could be, yes.
Yeah.
So if you suspect a fungal infection or you've maybe seen fungal elements on the urinalysis, you really need to specifically ask the lab to do a fungal culture.
Okay, request it specifically.
Right. And then identifying the exact species relies on looking at how it grows, its characteristics, its morphology, on a special fungal medium called Sabard's dextrose agar. Think of it like gourmet food specifically for fungi.
Got it. Special agar for the fungi. And once you know what fungus it is, how do you know what drugs will work against it?
That's the next step. Antifungal sensitivity testing, or susceptibility testing.
Like antibiotic sensitivity testing, but for antifungals.
Exactly the same principle. Now, the good news is that Candida albicans, the most common one, is usually sensitive to a drug called fluconazole. Because it's usually sensitive, the guidelines suggest you might not always need to do sensitivity testing right away. If you identify C. albicans, you could potentially just start treatment.
Makes sense. It usually works.
But the other Candida species, the non-albicans ones, they're actually more likely to be resistant to fluconazole.
Oh, okay. So for those, testing is more important.
Definitely recommended for the non-albicans Candida. And it's also recommended for any infection caused by a non-Candida fungus or for any fungal UTI, even Candida, that isn't getting better after, say, 4 to 6 weeks of what should be appropriate treatment, like fluconazole, then you really need that sensitivity data to guide you.
Right, to make sure you're using the right weapon, essentially. So it's a tailored approach. Okay, let's move on to treatment then. How do vets actually tackle these infections once they're diagnosed?
Well, the first thing, maybe the most critical, is to look for and, if possible, correct any of those underlying risk factors we talked about.
Right, like getting diabetes under better control.
Yeah.
Or maybe removing a catheter if it's feasible.
Exactly. Managing the diabetes, minimizing catheter use or duration, things like that. The sources also mentioned something called urinary alkalinization, making the urine less acidic. Apparently that was historically recommended.
Oh. Does not help.
Well, that's the thing. Its actual benefit for fungal UTIs is considered unknown, not well proven.
Huh. Interesting how some older recommendations stick around.
Yeah.
So what about the actual antifungal drugs? You mentioned fluconazole.
Yes, oral fluconazole is generally the first choice, the go-to drug initially. The dosage mentioned is typically 5 to 10 milligrams per kilogram of body weight given by mouth every 12 hours.
Okay. Are there other options? Like atroconazole or ketoconazole? We hear about those sometimes.
There are, but they're generally not recommended for urinary tract infections.
Yeah.
It's mainly because they don't get excreted into the urine in high enough concentrations. You need the drug to actually reach the site of infection, the bladder and urine, in strong enough levels to kill the fungus. Fluconazole does that well. Itraconazole and ketoconazole don't as much.
Ah, that makes perfect sense. Location, location, location. Even for drugs. Now, the information also mentions something about putting medication directly into the bladder.
Yes, for infections that are proving stubborn, maybe they haven't cleared up after 4 to 8 weeks of oral fluconazole.
Okay, for persistent cases.
Right. There's a technique called intravesicular infusion, basically instilling a solution directly into the bladder.
What solution?
It's typically a 1% clotrimazole solution. Clotrimazole is another antifungal.
Okay, how does that work?
Well, the procedure usually involves placing a urinary catheter, emptying the bladder completely, and then slowly infusing a measured amount of this clotrimazole solution. The volume is usually around 7.5 to 10 milliliters per kilogram of the animal's weight, but it's often guided by feeling how full the bladder is getting.
And then what? Does it just stay in there?
The goal is to keep it in the bladder, in contact with the lining, for about 15 to 30 minutes.
How do you manage that? Especially in a dog.
It can be easier in cats. Apparently, you can sometimes just hold off their urination. In dogs, they might need a special catheter with a balloon, a Foley catheter, to block the exit temporarily.
Okay, that sounds quite involved. How often is it done?
It's usually repeated every 7 days for at least 3 treatments. And importantly, the oral fluconazole is often continued at the same time. It's like a two-pronged attack.
A very targeted approach for those tough cases. What about really strong guns like amphotericin B? Is that ever used?
The sources do mention amphotericin B. It's been tried, sometimes given IV, sometimes instilled into the bladder like the clotrimazole, but its effectiveness for fungal UTIs specifically is basically unknown. It's only been used in sporadic cases, not really studied systematically for this.
So not a standard approach.
Not at all. And there's also a mention of benign neglect.
Benign neglect. What does that mean?
Essentially, for an animal that has no symptoms, but the infection persists on culture despite trying treatment. One option discussed is just monitoring them regularly without active treatment.
Just watch and wait?
Kind of. But it comes with definite risks. The infection could still ascend to the kidneys, cause that pyelonephritis, or even spread systemically. So it's a decision made very cautiously, if at all.
Yeah, that sounds like a risky path. Now, that bladder infusion with clotrimazole, you said it's for persistent cases. Are there times you definitely shouldn't do it? Contraindications?
Yes, there are. While it seems generally safe, the sources note its safety hasn't been completely rigorously investigated. But the definite contraindications are recent bladder surgery or any kind of recent trauma to the urethra. You wouldn't want to be putting catheters and solutions in there then.
Okay, that makes sense. Avoid irritating an already compromised area. And after treatment, what's the follow-up? How do you know it's really gone?
The goal is to continue treatment until you get 2 negative urine cultures in a row.
2 negatives. How far apart?
Taken about 14 to 21 days apart, so 2 weeks or so between them. That gives you more confidence the infection is cleared.
And then you stop the medication.
Yes. But follow-up doesn't end there. It's recommended to do another fungal urine culture about 60 days, so roughly 2 months, after stopping the therapy.
To check for relapse?
Exactly. And then potentially check again at regular intervals after that, just to keep an eye on things and make sure it doesn't come back.
Right. Sounds like a thorough plan for what can be a sneaky infection. Okay, so as we wrap up this deep dive on fungal UTIs in dogs and cats, what are the main things you think we and our listeners should really take away?
I think the key points are, 1, fungal UTIs, while not super common compared to bacterial ones, are definitely a real thing. 2, be particularly aware of them in animals with those risk factors, diabetes, catheters, chronic steroid, or antibiotic use.
Right.
3, diagnosis isn't always straightforward. You need specific fungal cultures. You can't just rely on seeing something under the microscope. And 4, treatment usually starts with oral fluconazole, but for persistent cases, that intravesicular clotrimazole infusion is a really important option to know about. And always, always look for and address those underlying risk factors.
Excellent summary. It really highlights how these seemingly simple things, like a UTI, can have these fungal twists. Okay, on that note, here's something maybe to ponder. With antibiotic resistance becoming such a huge global issue, and knowing fungi are opportunists, could we start seeing fungi play other unexpected roles in animal health, roles we haven't really recognized yet?
That's a fascinating and, frankly, slightly worrying thought, isn't it? How might our whole approach to diagnostics and even treatment need to change in the future as these microbial landscapes shift? What other surprises might fungi have in store?
Definitely food for thought, something to keep in mind until our next deep dive. Thanks for joining us.